where the problems exist, which is going to lead me to some of the research, is sometimes parents are in denial. I would like to say they don't want to see some of these symptoms. And so when they give us a history, they are not as open about the history. And again, this happens to me a few times a month where I'll sense something, have a communication with a school, and what I'm seeing, the school is seeing, but the parents sometimes, Vera, just will minimize that. Because also, as a parent, and you're a parent, we know how to read our children. So when they have a need, a want, we can almost speak and do for them and
Yeah.
see, right? So
Wait
you
for
may miss things
right, right.
because you read your child so well, so you don't see it. So it's not, of course, done purposefully. It's more or less they're just not aware because they're so in tune to their child. And if they don't have multiple children, or even when they do, they don't necessarily see all that maybe we're seeing that may be indicative of autism.
Right. And I think you made a very good point about denial. And I would say that we have to help parents become aware and come to terms with the diagnosis, knowing that if it is autism level 1, what does that mean? And what does it mean in terms of treatment, right? Which we can talk about it later, but it helps understand some of the puzzles that don't fit necessarily to another child with SM that doesn't have ASD. When I do interview parents and we have the questionnaire that we created, we also do questionnaire and interview. We ask questions and they say, "How did you know to ask that question?" Like, I have to wash the shirt every day and dry it because otherwise my child is not going to wear any other shirt to school, or I have to give chicken nuggets from Wendy's and French fries from Burger King, or my child has a repetitive behavior or very, very isolated interests in, let's say, dinosaurs or puzzles or Legos. And if we don't ask the question, right? If we don't have
Yes.
those questionnaires and if we don't ask the question, we may not have the clear picture. And in terms of denial, I think people have denial to the diagnosis of autism when they don't know much about it. And when we tell them the benefits, although many very bright and professionals in our area, parents, may be in denial. But when we show them, parents, the benefits of understanding the levels of impairment, also where they come from, it's really important to develop an intervention for a child who has repetitive behaviors or who has special interests or who has difficulty with social skills. It is different treatment plan than a child who just has selective mutism and is now 12 and didn't learn the social skills necessary at school, but is practicing those skills at home and has theory of mind and understands that. So I think when we join the parents in compassion and empathy, and we explain to them why a diagnosis of autism, in addition to SM or instead of, is important in terms of treatment plan, interventions, that they are better results because they are targeted to that. One example that I would love to discuss with you is the perfectionism that children with SM may have, a group of children may have. Usually it's not the same group that has the speech and language disorder. It's the another group that I see in general, but this is not scientific, it's just clinical impression of mine. The perfectionism and the tendency for obsessions and compulsive behavior and the sensory modulation difficulties that you and I talk about, food restriction, it's tags, or you talked last time we had a podcast, you talked about visual hypersensitivity and auditory. We have that. It's a little bit different in SM and ASD and how we treat that. So, depending on the diagnosis, we do different interventions for the child. And that's why the better diagnosis and the more refined, the better outcome is possible. You agree with that?
No, I absolutely do.